I've been utilizing the ENDOCUFF Vision since it became available. So I utilize ENDOCUFF Vision in the great majority of routine colonoscopies that I do. So screening exams, surveillance examinations, and diagnostic examinations. The exception would be, for example, if I know that the patient has significant sigmoid diverticular disease, because having the device on increases the diameter of the tube that you're inserting, and you could encounter a bit of difficulty. And there are a small percentage of cases where you don't know that the patient has sigmoid diverticular disease, but you're going to encounter it and you'll need to stop and take the device off. Another indication that I usually would not use it would be inflammatory bowel disease, especially in that instance or any instance where I really need to get into the terminal ileum and get in deeply, because again, it makes it a little harder to get in the terminal ileum and to go deeply into the terminal ileum. But basically for routine examinations where the goal is to find polyps and remove polyps, I like to have the device on the scope. Well, the main advantage, of course, of the ENDOCUFF Vision is that it improves detection. That's our fundamental goal when we're performing the great majority of colonoscopies. We want to find the precancerous polyps, flat lesions that are in the colon, and then remove them, and remove them effectively. But we can't do that unless we first find them. So the whole thing is about detection. And meta-analyses suggest that the average increase in the adenoma detection rate is about 7%. We know from the Kaiser study, Doug Corley's study, that for each 1% increase in the adenoma detection rate, there's a 3% reduction in the chance of colorectal cancer. There's a 5% reduction in the chance of fatal colorectal cancer. So there are some clear benefits for our patients. So that's number one. There's a strong suggestion that there's some improvements in efficiency, and it's really unusual to have a device that actually improves detection and at the same time can make you more efficient. So on the efficiency side, first of all, with regard to insertion, the evidence is that most people actually get to the cecum faster with the ENDOCUFF Vision on. As we reduce the loop in the insertion tube, the tip of the instrument often falls back. With the ENDOCUFF Vision on, the fingers hold the mucosa and the tip of the instrument tends to stay in place. So you can reduce the loops more efficiently without falling back. That's my own theory about the mechanism by which insertion time actually shortens. You reach the point more quickly where you feel like you have seen everything and you're able to move on. So it's the combination really of improved detection as well as these pretty strong suggestions of improved efficiency that are the drivers.